Hi, I'm Ian Wong, a lung and ICU doctor at Duke University. Today I'm here to talk to you about why a PFT needs to know my sex at birth. I mean, all people have lungs, right? If you remember the PFT example from earlier and look at the top, you'll notice that it says three things. 1. Gender, or really sex. 2. Age. And 3. Height. So, why does this really matter? Modern lung medicine uses these numbers to figure out what is the range of normal for someone of your height, your age, and your sex, and where you stand in respect to these. To understand this, let's look at how your lungs change throughout your lifespan. As you grow from childhood, your lungs are very small. They get larger until your young adulthood, somewhere in your 20s to 30s. And then as you age past that point, your lungs slowly start to reduce and become less functional over time. Why does this also happen? What do the rest of these and how do these play a role? If we look at it this way, your lungs are like a balloon and your ribs are like a cage. The biggest the balloon can possibly get if it's inside the cage is the size of the cage. So as that cage grows bigger, as that cage grows more voluminous, so do your lungs as well. So 3 comparisons, as we've discussed, your lungs are their biggest in their middle age and are smaller both when you're in childhood and when you're very elderly. As you might expect, a taller person might have a larger rib cage than a shorter person. Lastly, a male for the same height and age tends to have a larger rib cage than a female. Sex at birth plays a role, especially when we care for transgender patients. If we're caring for a transgender patient who is transitioning from male to female, then if we used a female normal range on a male's underlying lung structure, we might not diagnose disease when there might be disease in the lungs. On the other hand, if you're caring for a transgender patient who is transitioning from female to male, for example, and we used the male standard ranges for when we're caring for a biologically female lung structure, then we might diagnose disease for this patient when there actually wasn't. So knowing sex at birth helps us care for our patients better and diagnose disease more accurately. Thanks for watching, and please tune in next time.